Dr. Allie, when should I expect my period after giving birth? Hey, I'm Dr. Allie, an OBGYN. Largely, this is going to depend on whether or not you're breastfeeding. When you're exclusively breastfeeding, prolactin, which is a hormone in the brain, is very high. So prolactin suppresses ovulation, and without ovulation, there's no period. I'm talking about period blood, not that like bleeding you have a couple weeks after having a baby. That's not a period. That's your uterus going back down to its normal size. You're getting rid of cells, of tissue, of mucus. So that, like, the bleeding you have after birth is not a period. Now, if you're not breastfeeding, which is great, formula feed, breastfeed, doesn't matter. Fed is best. Just feed your baby however you can. Okay, I got sidetracked. But if you're not breastfeeding, then you should expect your period usually about 5 to 6 weeks postpartum. But remember, everyone is different. Remember, if you got a period, that means you ovulated, so there's a chance you can get pregnant. If you're not trying to get pregnant 5 to 6 weeks postpartum, definitely use protection or have a form of contraception, birth control, that you want to use after giving birth. Definitely recommend having the discussion about birth control options while you're pregnant so that you have a plan in place after you give birth. I think it's super important to talk to your OBGYN, your midwife, your provider, whoever's taking care of you during pregnancy. I think it's super important to talk about your family planning, the timing of when you want to have kids. That way you kind of have a plan moving forward, and if there's ever roadblocks or you need birth control or something were to happen, you have your provider on your side and your team. Like, they're part of the plan. They know your desires and what you want. Don't fall into the myth that breastfeeding is birth control, because it is not. And if you're not exclusively breastfeeding and you're combo feeding like what I did, so I breastfed, but then I also had to supplement with formula because my supply was kind of up and down. So if you're like me, your period is going to be probably irregular and hard to predict when you're gonna get it. I would say I got my period, I think I was 3 months postpartum, and I had my first period. Then I didn't get anything for like a month and a half. Then I got a period again, then I didn't have anything. So it was really hard to track. It's irregular, and it is not birth control, because anywhere in that window, you can be ovulating and you can get pregnant. And if you missed the announcement, that's what happened to me. Yeah, I'm an OBGYN, and clearly I know these things happen, but I'm letting you know, breastfeeding, especially if you're combo feeding and you're not exclusively breastfeeding, is not birth control. Honestly, even exclusively breastfeeding, not very reliable.